Well, with just 11 days to the lapse of the restrictions to stop the spread of the virus, President Uhuru Kenyatta now says the decision to reopen the country lies with the county's ability to respond to a surge in the number of infections. So far, only 12 counties have set up the required 300-bed capacity isolation facilities. Leila Mohammed reports that the Council of Governors called for a gradual reopening of the economy, subject to the setting up of a strict regime of containment protocols.
As the number of infections race towards a peak, the head of state is weighing in on what the future looks like and the delicate decisions he has to make.
County governments and their readiness to respond to new imported cases of infection will also equally largely determine our national readiness to reopen the country as a whole.
The Council of Governors says the movement restrictions should not be lifted unless the proposed strategies to enhance testing and screening at county boundaries, contact tracing are adequately implemented. They also want the curfew in place for as long as it takes to flatten the curve. So far, only 12 counties have attained isolation facilities with a 300-bed capacity. 34 counties are working to put in place the facilities before the 30-day period lapses. However, 16,914 health personnel had been trained on COVID-19 management, among them 59,449 community health volunteers.
They're able to work as monitors and evaluators of our home-based care program.
COG is banking on 4.6 billion shillings, which it is asking national government to release under the devolution support program. And while both tiers of government fight on one front, those on the front lines are fighting other battles in their minds as the pandemic takes an emotional toll.
For over 3 months now, healthcare workers across the country have been taking care of the health needs of various COVID-19 patients within this country. But at the moment, the ministry now says it is important to take care of them for them to help others.
Doctors, nurses, lab people, they also cry. They feel pain.
The healthcare workers can now call and speak to a mental health specialist. The call service will be available 24 hours a day.
We have people across the country, actually in 45 counties, that can be called upon to be able to provide the psychosocial support.
Leila Mohammed, NTV.